Hello everyone. So in this video I am going to tell you about the Progeroid syndrome, and it is very important topic related to the NEET PG. So for this we have to study the Progeroid syndrome, in which the first category includes the Werner syndrome, that is Werner syndrome. Please remember, it is Werner, not the Werner. So in Werner syndrome, and the other name is adult progeria. Adult progeria. So the other name of it is the adult progeria, which is also known as Werner syndrome. So what will happen? First we have to remember the defect, gene defect. So please remember, from the Werner, W, R and N, means in this WRN gene defect will be there. WRN gene defect will be there, and in this this WRNA gene defect, so this is a member of DNA helicase family. So Werner syndrome is a member of DNA helicase family. Please remember, it is the previous year question. So it is the member of DNA helicase family. Werner syndrome, WRN means WRN gene defect will be there, and the other name is adult progeria. So in the Werner syndrome we have to remember that it is autosomal recessive. So it is a autosomal recessive inheritance. In this there is autosomal recessive inheritance. Means in this usually normally till puberty aging begins in adults. So in this there is, like, till puberty there is normal person, but after the puberty the person starts getting aging. So it is autosomal inheritance, and in this usually the person is normally till puberty, but after that the person starts becoming aging. So aging begins in adults. So as in this image, till 15 years old it is looking like normal, because till puberty the person looks like normal, but after the puberty the person suddenly becomes aged. Like 25-year-old person has gray hair and it's look like old person. So what were the clinical features, how we can identify? So for the features we have to see that the person has graying of hair, hair turns, graying of hair is there. The person has type 2 diabetes mellitus, starts the cataract, and also the person has starts the cancer. So all these features were seen in the Werner syndrome: graying of hair, type 2 diabetes mellitus, cataract and cancers. Now from this Werner syndrome, so first, which gene defect is there? WRN gene defect is there, and it's involved the DNA helicase family. These questions were very important. Now the next turn, just opposite to it, like in the Werner syndrome aging is in the after puberty, and the second one, the just opposite, that is the Hutchinson Gilford syndrome. So in the Hutchinson Gilford syndrome, it's just opposite to the Werner syndrome. So in this it is a laminopathy. So in this it is a laminopathia, and the gene which involved is, as it is laminopathia, so the gene involved here is LMN A gene is there, or we can say lamin gene is there. Now in this, as it's just opposite to the Werner syndrome, in Werner syndrome after puberty there is aging started, but here it's just opposite. In the childhood, aging begins in early childhood. So here aging begins in early childhood. As we see the movie Pa, in which the child it's look like a aging person. So here the aging begins in early childhood. It is because of the LMNA gene defect, and its syndrome is Hutchinson Gilford syndrome. And in this we can give one medicine for the treatment. So for the treatment, the medicine which is given is 4-methyl transferase inhibitor. 4-methyl transferase inhibitors, and its trials is going on. So 4-methyl transferase inhibitors, FTI. trial is going on. So now in Hutchinson Gilford syndrome, this medicine is on trial, and in Hutchinson there is aging begins in early childhood. As we see here, all these childs were looking like a aging person. Now the third one, the third progeroid syndrome, that is the Bloom syndrome. Third one is the Bloom syndrome. So as the Bloom syndrome, BLM, so the gene involvement, the gene defect is BLM, gene mutation is there. BLM gene mutation will be there, and it encodes the DNA helicase. Please remember that it encodes the DNA helicase. So in the Bloom syndrome, what the basically happen, that the patient has the short stature. So patient has short stature. He develops the photosensitivity, telangiectasia is there, dilation of vessels, telangiectasia will be there, and its increased risk of cancers will be there in Bloom syndrome patient. And please remember here the gene, that is BLM, gene mutation, means BL and M, Bloom syndrome. So as we see in this image, the photosensitivity, as redness will be there, so this is a photosensitivity will be there, and inflammation of the hand joints will be there, so maybe there is any kind of cancer will be there. So this is the Bloom syndrome. Now the fourth syndrome of the progeroid, the fourth syndrome, that is Roth-Mund-Thomsen syndrome. Roth-Mund-Thomsen syndrome. And in the Roth-Mund-Thomsen syndrome, as we have to remember the gene defect, so please remember R for Roth-Mund and R for RAC4 gene. R for RAC4 gene mutation will be there. RAC4 gene mutation will be there. And in Roth-Mund-Thomsen syndrome, what will happen? So for that, for the remembrance, we have to write Roth like this. And in this we can easily remember the clinical features, like R stands for rash, and other R stands for RAC4 gene mutation, and O stands for there is a cancer of osteo, means bone cancer will be there, so osteocancers will be there, and the other O, as O looks like the eyes, so there is cataract will be there, so cataract will be there, and TH for thin hair, So this is the Roth-Mund-Thomsen syndrome. Now we can we can draw one diagram also. Suppose this is a person's eyes, and there is like thin hair will be there. So thin hair will be there. So there is sparse scalp hair. There is sparse of eyebrows. There is facial rash is there, or we can say there is poikiloderma is there, or we can say facial rash, and there is juvenile cataract will be there. There is juvenile cataract will be there. So these were the features of the Roth-Mund-Thomsen syndrome. Now the fifth syndrome of progeroid syndrome. The fifth syndrome is Cockayne syndrome. COCKAYNE. This is a Cockayne syndrome. So in the Cockayne syndrome, we have to remember the gene again. So please remember here C is repeat. So in the gene also there is CC is repeat, like ERCC6 and ERCC8. ERCC6 and ERCC8 gene involvement will be there. So C and C. And in this we find the clinical feature that the person is dwarfism will be there, and cachexia will be there. Cachexia are characteristic features of Cockayne syndrome. Characteristic features. Now the last, that is the fifth one. So the fifth progeroid syndrome, that is the Fanconi anemia. Fanconi anemia. So in the Fanconi anemia, we have to remember again gene. So please remember Fanconi, take out the fan, FAN, fan. So the gene here is FAN CA, FAN CB, FAN CC, etc. So there is multiple gene involvement is there. So there is multiple gene involvement is there. And in Fanconi anemia, basically it is a inherited bone marrow failure. So it is a inherited bone marrow failure. So in the Werner or Wermer syndrome, as I already explained, please remember that Werner and Wermer. So Werner, and so there is premature aging in Werner syndrome. There is premature aging. While in the Wermer syndrome, it is associated with Man 1 syndrome. It is associated with Man 1 syndrome. So that's all for today. Thank you. Bye bye.